Hello everyone, let me introduce myself. My name is Naia Aulia. I'm from English Education Study Program at Aulia University. So now I will do a presentation on mental health. And here I have summarized some important points from the theme of my presentation, which is mental health. On the first slide, there is a table of content, where in this table of content, you will find out some of the material sequences and points that I will explain. Starting from the introduction, then the first is a definition of mental health. The second, there are signs of mental health disorders. The third, there are types of mental health disorders. The fourth, factors of mental health disorders. The fifth, how to overcome mental health disorders. And the last is conclusion. First, I will explain the definition of mental health. Mental health is a state of emotional, physiological, and social well-being in which a person realizes their ability to manage stress, establish healthy relationships, adapt to life changes, and feel, understand, and cope with emotions, which is able to cope with normal life pressures. However, lately, mental health has become a serious problem experienced by some critical age groups of adolescents or young adults, with the population of the 10 until 19 age group reaching 44.5 million. Indonesia must start investing in adolescent mental health, which is starting to show symptoms in various potential physiological conditions and mental disorders. According to the article I have been read, 1 in 20, around 5.5% adolescents in Indonesia are diagnosed with mental health disorders. According to the Diagnostic and Statistical Manual of Mental Disorders, or DSMV, by the American Physiological Association, or APA, this means that around 2.45 million adolescents across Indonesia are categorized as people with mental disorders. And this is the data evidence of mental health disorders that occur in Indonesia, which I have just explained. Next, I will explain the signs of common mental health symptoms. Common symptoms are excessive worry or haunting feelings of guilt, drastic mood swings, seeming to withdraw from friends and social environments, significant fatigue, decreased energy, having trouble sleeping, false beliefs or delusions, seeing or hearing things that are not real, or hallucinations, and behavioral change. Difficulty performing daily tasks, physical symptoms, fatigue, headache, body pain, and digestive problems. Then on the next slide, there are types of mental health disorder caused by the symptoms of the previous mental health symptoms. First, anxiety, and second, depression. Anxiety. Anxiety is a feeling of anxiety that a person experiences due to feelings of discomfort or worry. It occurs continuously, which is excessive and disrupts physical and mental health, triggered by various thoughts and conditions. Second is depression. Depression is a mental health condition that affects changes in mood or mood such as feelings of sadness, loss of enthusiasm, loss of interest in activities that are enjoyed with a prolonged time span. And depression is also referred to as a common mental disorder characterized by a sense of low self-esteem, worthlessness, and hopelessness. Next, on the first slide, I will explain what factors cause mental health disorders. Factors that lead to mental health disorders include genetic factors. There is a history of family members who have mental health disorders or have chemical compound abnormalities in the brain. And the second is economic factors. Experiencing economic loss, such as job or income loss and poverty, can lead to excessive stress and anxiety disorders. Third is physical factors and experiencing physical and sexual violence, if not treated properly, can cause prolonged trauma that leads to mental health disorders. And the last is social factors. Experiencing discrimination or stigma and living in a poor housing environment can make a person feel isolated and depressed. Therefore, there is a need for prevention that can address to the problem of mental health disorder. And in this light, there are several ways that mental health disorders can be overcome. First is strengthening social support. Second, get enough sleep. Third, development soft skill for reduce stress. And the last is participating in health education. And the last is conclusion. The conclusion of the material is mental health is essential for emotional, physiological, and social well-being. With a variety of symptoms and disorders, genetic, economic, and social factors play a role in mental health disorders. Ways to address them include therapy, social support, and maintaining physical health. Okay, guys, maybe that's all my presentation about mental health. Hopefully, my presentation is helpful for everyone, and thank you.